Welcome to part 4 of our Brain to Tailbone series. If you've been following along, you know that we are traveling down the superhighway of the human body, the spine. So far, we have explored the occiput, the atlas, which is C1, and serves as a gateway for neurological communication, and the axis C2, which allows for incredible range of motion in our heads. So today we moved just an inch further down and we're at the C3 vertebra. While it might seem like just another block in the cervical chain, C3 holds a unique and powerful position. It is the bridge between the upper cervical spine and the middle neck, and its influence extends far beyond mere structural support. In fact, if you have ever struggled with stubborn skin issues, facial pain, or an outer glow that seems to have dimmed, the answer might not be in your skincare cabinet. It might be in your neck. Well, understanding the C3 anatomy, let's go. So the C3 vertebra is the third bone in the cervical spine. Anatomically, it is the first of the typical cervical vertebrae, meaning it begins to take on the classic shape that we see throughout the rest of the neck. It sits right at the level of the jawline and the upper throat. But the bone itself is only half the story. The real magic lies in the C3 spinal nerve roots. These nerves emerge from the spinal cord through small openings between the C3 vertebra and join a network known as the cervical plexus. From here, they branch out and provide sensation and motor control to the very specific areas of your head and face. Let's talk about the nerve organ connection, what C3 actually controls. In the chiropractic care, we look at the body through the lens of innervation. Every organ, muscle, and patch of skin requires a clear signal from your brain to function correctly. When the C3 vertebra is properly aligned, the nerves flowing through it can effectively manage things like the cheeks. C3 provides sensory input to the sides of your face, the outer ear. Have you ever had a strange sensation or itching in the outer ear that didn't involve an infection? C3 may be the culprit. Facial bones and teeth. While the cranial nerves do much of the heavy lifting here, the C3 nerve provides essential support to the structures of the face and the health of the dental environment. The facial nerve. C3 plays a supportive role in the complex web that governs facial expression and sensation. When we talk about the outer glow, we aren't just using a marketing term. A healthy C3 ensures that the blood flow and nerve signals to the skin of the face are vibrant and unobstructed. This is the physiological foundation of looking and feeling healthy. A subluxation is a term chiropractors use to describe a misalignment of the vertebra that interferes with the nervous system. Because C3 is so closely tied to the face and skin, the symptoms of a C3 subluxation are often visible to the naked eye or felt as a sharp, distressing sensation. If your C3 is misaligned, your body might send you a check engine light. This can happen in the following ways. Number 1, neuralgia and neuritis. Neuralgia is a sharp, shocking pain that follows the path of a nerve. When C3 nerve is compressed or irritated, it can cause facial neuralgia, leading to unexplained pains in the jaw or cheek. Neuritis or inflammation of the nerve can lead to dull, constant ache or a feeling of heaviness in the side of the neck and face. Sometimes these issues are misdiagnosed as dental problems because the pain radiates so close to the teeth. If you've been told your teeth are fine, but the pain persists, it may be time to look at your neck. You can read more about how these signals act as warning signs in our post. The headache you might keep ignoring might be your body's check engine light. Number 2, acne, pimples, and eczema. This is often the most surprising connection for our patients. How can a bone in the neck cause a breakout on the skin? Well, the nervous system controls the diameter of the blood vessels, vasodilation, and the function of sweat and oil glands. So when C3 is subluxated, the nerve signals to the skin of the cheeks and the face become noisy or weak. This can lead to poor lymphatic drainage and an inability of the skin to regulate oil production or heal itself efficiently. The result? Persistent acne, eczema, or skin that looks dull and inflamed regardless of how many topical creams you use. Number 3, the tech neck impact. In today's digital age, we spend hours looking down at our phones. This puts an immense amount of pressure on the mid-cervical spine, specifically C3. This repetitive stress can lead to chronic misalignments. We've discussed the strategy for combining this in our guide on how to beat tech neck while working remotely. It's on our website. So let's talk about the phrenic nerve, a life-sustaining connection. While we're focusing on the outer glow, we cannot ignore the vital internal function of C3. There is a common phrase in the medical community, C3, C4, C5, keep the diaphragm alive. The C3 nerve root contributes to the phrenic nerve, which is the primary nerve responsible for the contraction of the diaphragm, the muscle that allows you to breathe. While a minor subluxation at C3 might not stop you from breathing, it can certainly affect the efficiency of your respiratory system. Shallow breathing or a feeling of tightness in the chest can sometimes be traced back to the cervical plexus and the health of the C3 through C5 region. Restoring the glow. What is the chiropractic approach? At Carlucci Chiropractic and Wellness, we don't just crack necks. We perform a clinical analysis to see where the nervous system is being hindered. For a patient presenting with skin issues or facial neuralgia, we look specifically at the alignment of C3 vertebra. By performing a precise professional adjustment, we remove the interference on the C3 nerve. This allows improved circulation, fresh oxygenated blood can reach the facial tissues. Neurological balance, the glands in the skin receive the correct signals for oil and sweat production. Pain relief. Pressure is taken off the nerves, reducing or eliminating neuralgia. So chiropractic care is about more than just back pain. It's about ensuring your body's internal communication is crystal clear. When the brain can talk to the face without interruption, your outer glow returns naturally. Is your C3 trying to tell you something? If you find yourself constantly battling skin irritation, ear discomfort, or facial tension, it's time to stop looking at the symptoms and start looking at the source. The health of your spine is a reflection of your overall wellness. Whether you're in the Montclair area or surrounding area, we are here to help you navigate your journey from brain to tailbone. If you're new to chiropractic and want to know what to expect, check out our guide on 10 things you should know before you visit your chiropractor. Connect with us. Ready to clear the path to your health. Well, we offer a variety of services designed to help you reach your peak potential. So you can book an appointment, you can contact us, you can explore services, wellness services, shop wellness services on our website, which you can find other resources as well in our link tree, which should be listed above. Stay tuned for part 5 of the Brain to Tailbone series, where we move down to C4, the center of the neck and a key player in your respiratory and thyroid health. Have a fabulous day. Thanks for watching. Share, like, enjoy.